we have with us Dr. Banerjee of AIMS Kalyani. Dr. Banerjee, it was lovely listening to your talk today at CAHOLABCON. And what I really want to ask you is, other than the experience that you had here, is your experience during pandemic? Because what I understand is that during pandemic, you had certain suggestions to the government, and post your experience, you had some findings in terms of why the people in the urban slums were not getting affected as much as those people who came from the upscale areas. So, can you share your experience and also share what you found out, and what is it that you want people today, the doctors, to actually work on and study to prove what you felt was a reality?
Thank you for bringing in this very interesting topic for me. So in 2020, in the first year of COVID, I was performing a very different role. I was working with the World Health Organization Southeast Asia Regional Office, and where we were leading a team called the Rapid Research and Innovation Cell for COVID-19. And just in the beginning, when COVID, even it didn't come in India, it was in January 2020 when it was first reported. We started our modeling team and we forecasted that COVID is going to hit worstly in the most densely populated areas of India and the Southeast Asia. And as soon as, the government started planning of the lockdown following the Chinese model of lockdown, then we were super afraid because the lockdown means, particularly for urban slums, increasing the number of, the population density. Normally the daytime urban slum population density is actually quite low, where people go out for walking. If you go to Dharavi urban slum and if you see the bathrooms prepared by the Brihan Mumbai Municipal Corporation, you will hardly find 50 people using the bathrooms in normal daytimes. Whereas during the COVID lockdown, there were 200, 250 or 300 people using the same number of bathrooms. So what we were afraid that COVID will spread very fast and will cause severe number of deaths in urban slums. And we warned the government for that. And we started working with the people's representative of Dharavi and other slum community-based organizations. But with the first year, with a few months in COVID, 6 months, 1 year in COVID, I had a completely different experience. Somehow, in the second year, I took up a different role. I was in leading a clinical ICU in Calcutta in one of the biggest public hospitals in Beleghat ID Hospital, infectious disease hospital. It was actually surrounded by slums. And we didn't get a single severe COVID patients from the slums where people were dying during the Delta variant, And I raised the issue to the government and my senior mentors in ICMR and other organizations who were determining the policy. And they told, Sayantan, that the people in slums are young, they are thin, they don't have communicable diseases. It was not actually that. I went to the slums. I found people to be very obese, smokers, having lung disease, heart disease, diabetes. Urban diabetes is like pandemic in urban slums right now. So, but something was preventing severe COVID, in urban slums. So what I wanted the scientists and the clinicians to emphasize on is what we later found out, that the COVID-related death is not because of the COVID virus. It's mostly because of the cytokine storm, the inflammation, the body's extrovert immune response, which is too much, which should have been lower, but it's too much against the COVID virus, and that kills you. But probably this, what we found in later studies, that because of so much of viral, parasitic, bacterial exposure in the urban slums, because the water, the sanitation is not good, the drinking water quality is not good. Because of overcrowding, you are exposed to too many bacteria and viruses, and tuberculosis and parasitic infections. Probably the innate immune cells, the macrophages, monocytes, they become, kind of poised and swave in their immune response. So it's sort of something like that if a rat comes in, you jump and you fall down and you break your arm, but the rat couldn't have broken your arm. It's your response that breaks your arm. And here, among the slum people, the immune cells are behaving in a much more gentle and suave way that are not killing them in response to COVID. So what I want to emphasize is probably we need to rethink about the sterile life that we are trying to, we're choosing now. In our childhood days, we had much more exposure to mud and dust and, the muddy football grounds, etc. Where my child getting, raised in an urban society is being raised up in a sterile environment. So probably we need to look back and we need to go back to the nature and environment and start, playing with dust.
So you feel that, people who are more exposed to an environment which makes their body more immune to accept and fight these kind of conditions helps.
So I would not use the term more immune. I would use the term immunologically they are more wise. It's not about, there may be 2-3 persons facing a same problem. It's not always the most muscular guy, the most, the robustly bodily built person will deal a worldly problem better than a very small, lean and thin guy. And the small, lean and thin guy can actually win over a much bigger problem just being very calm, composed and responding appropriately to a problem instead of reacting to it. So always the more immunity that we talk about, we have to be more immune. We have to be more immune. It's not about more immunity. It's probably more about, suave kind of immunity, poised kind of immunity. It's a graceful immunity that is important than more immunity.
Right. And Dr. Banerjee, you are at CAHOLABCON. What has been your experience speaking at CAHOLABCON, and how do you think this is creating a positive impact in the ecosystem?
So this is a wonderful conference, and regarding CAHOLABCON, what I really like is they emphasize entirely on quality control of the laboratories. And CAHO has been a wonderful organization and association which has been, stimulating for quality control in the hospitals. Particularly, what I feel right now is because of the globalization of knowledge and availability of tools and expertise, we have wonderful experts in India. But the problem is in the public hospital, particularly in the public funded hospital, the government hospitals, and in big private hospitals, you have to ensure the quality of service for maintaining patients as well as caregiver safety. So I would congratulate CAHO because of their strong emphasis on quality control. And, many people are doing testing, many people are treating patients, but maintaining quality to not do harm, primum non nocere, is something which we are taught according to the Hippocrates Oath. So this is what CAHO is doing, and I congratulate them for organizing this wonderful conference.
Thank you so much, Dr. Banerjee, for joining us, and wish you all the best.
Thank you. Thank you.